Welcome to 101nursing.com. My name is Priscilla, and today we'll be talking about coronary artery disease. Coronary artery disease is primarily caused by atherosclerosis. Atherosclerosis is basically calcification of the arteries or any other vessel system. So calcification of the artery, meaning plaque is built up within the abnormally in an area such as your artery, and it crosses the arteries barriers because of the density of the lipids. The LDLs are very small lipids, so they build up, build up, build up until they build a wall or a blockage within your vessel. This is a normal vessel artery, and you don't see a lot of plaque buildup. But this is actually not really ideal. Everyone has a little bit of fatty streaks within their arteries, and fatty streaks are small little LDLs that it's just a building block of arteriosclerosis, if I can say that correctly. But fatty streaks is just lipids that migrate into the smooth muscles of your arteries, or of your smooth muscle. That they just migrate, and everyone has a little bit of fatty streaks if you live in the United States and you don't really have a good diet. Anyways, back to our guy here. And the primary reason why you get coronary artery disease is because not only is the plaque built on top of the vessels, or not, within the coronary arteries, but it narrows your arteries and does not allow for patent blood flow to supply your heart and to supply the rest of your body. And not only that, but an internal inflammatory cascade occurs, and this swells up the artery so badly that the air cannot flow. Not air, but the blood cannot flow as it should. Okay, let's jump right into the risk factors of coronary artery disease. Risk factors: modifiable and non-modifiable. Non-modifiable, as you guys can see, age, gender, ethnicity, and family disorder, genetic disposition. And if your family has a history of coronary artery disease, and if you have a cholesterol level of 600 plus, and there's a specific disease that goes hand in hand with that. The primary ethnicity that is affected with coronary artery disease is white middle-aged men have the highest incidences of coronary artery disease, followed by early age or onset African Americans, then Native Americans, and lastly Hispanics. Modifiable factors are your lipid levels, your triglyceride levels, your LDLs, your HDL. Hypertension, 140/90 is hypertension. There's no such thing as borderline. You either have hypertension or you don't have hypertension. Tobacco use, tobacco is bad. Some people have been trying to quit for years. Keep at it. Let them know that this disorder, this habit, not only can increase their chances for a heart attack, MI, angina, coronary artery disease, but as well as cancer. So healthcare providers, family members, keep pushing at it. Physical inactivity. Get physical, get active, start moving. Obesity, and that's indicated by the waist length of males and females. 40 inches plus for males, 35 inches plus for females. Diabetes is basically the death card in this, because diabetes decreases the flow of blood. It just makes your body sluggish in healing and in various different areas. If it's uncontrolled, sugar is a killer. Metabolic syndromes are borderline syndromes, like it's just a cluster of risk factors. Underlying pathophysiology may include insulin resistance, obesity, and hypertension, and elevated blood glucose levels. So moving on to psychosocial state, stress. If you have an increased stress in your life, high stress um, jobs like nursing or a doctor or businessman, those jobs, we need to find better ways to um, decrease stress in our lives. Homoglycic levels. Homoglycic levels are produced by the breakdown of essential amino acid metroponine, which is found in dietary protein, and high levels of that can contribute to atherosclerosis and also damage the inner lining of our blood vessels. So high levels of metroponine within the blood can cause damage. Substance abuse, smoking, cocaine use, meth, those stresses the body and just restricts your body and can cause plaque buildup and cause buildup of gunk and just garbage within your arteries and causing coronary artery disease. How do we prevent this? Obviously, everything that I just said in previously, modifiable, you can prevent it by stopping smoking, losing weight. Weight loss can alone decreases hypertension, type 2 diabetes, obesity, your LDL levels, and then your metabolic syndrome, and elevates your homeostasis, homeocytes levels, and it can basically kill cancer if you know how to exercise correctly and stay and maintain that level of fitness. And next, of course, we want to try and to keep and do this naturally without any medications, but not everyone has the luxury or has a discipline to maintain their levels and the fitness. In fitness, it's hard to work out sometimes for different types of people, but the better you work out and decrease that, the easier it will be for you in the long run. Next, if you can't tolerate fitness or working out or whatever and keeping a fit lifestyle, you're going to be put on medications. Primary medications are your statins, and your statin decreases LDLs, decreases triglyceride, and increases your LDLs, and it blocks the synthesis of calories and increases LDL receptors in your liver to excrete them. Next is your nystatin or nisan, and that's your Neospan and Novonistan, and these also decrease LDLs, decrease triglycerides, and increase HDL. Next, you have your fabric acid derivatives. So Tricor is a common med that I've seen, and that decreases LDL, decreases triglyceride, increases HDLs. And this decreases the hepatic synthesis and the secretion of VLDL. So that's another one for you. Next is your bile acid sequencers. That increases HDL and it helps you helps decrease hepatic secretion or synthesis and secretion of VLDL and reduces triglyceride by decreasing VLDL. Oh, I messed up in the other one. It doesn't increase, but it inhibits synthesis and secretions of LDLs within your liver, or VLDL and LDL. And next is your amino acid omega-3 fatty acids, and you want to increase that, and that inhibits synthesis and secretion of triglycerides. Oh, right in front of me. Calorie absorption inhibitor. Or cholesterol absorption inhibitors. And that's your azatime, as it, let's not even get into this med. But it inhibits the in it just inhibits the intestinal absorption of calories, decreasing LDLs and increasing HDL. So as a whole, all these medications decrease LDLs, decrease triglyceride, and increase HDLs, which is what we want. Thank you very much and have a great day.